Good afternoon. I am Jeff Chipman. I'm honored to be chair of the CancerCare Manitoba Board of Directors. I'm here with Dr. Shree Navaratnam, President and CEO of CancerCare Manitoba. Also joining us live in the studio is Ms. Jennifer Moore Rattray, who is the Chief Operating Officer with the Southern Chiefs Organization, Inc. Thank you for participating with us this year. We want you to know that we are all 6 feet apart, following public health orders, and are all fully vaccinated. I welcome all of you who have joined us virtually to the CancerCare Manitoba Board Annual Public Forum for 2021. I would like to begin by acknowledging that between 1871 and 1906, treaty commissioners acting on behalf of the Crown signed 7 treaties with First Nations leaders in what is now called Manitoba. This land on which we gather is the traditional territory of the Cree, Dakota, Dene, Anishinaabe, Oji-Cree, and Ojibwe peoples, as well as the homeland of the Métis Nation. As you know, the global pandemic changed many things for all of us in March of 2020, including how we communicate with you. We are fortunate that we are able to hold this event virtually. This brings with it the advantage of having you join us from across the province without having to travel. Thank you so very much for joining us today. We have an exciting and informative agenda that includes an update on the CancerCare Board, a presentation by Dr. Navaratnam on improving First Nations, Métis, and Inuit cancer control, and outcomes as a priority 6 of the roadmap to cancer control for Manitoba, and a community story from our guest speaker, Ms. Jennifer Moore Rattray. We will have a question and answer period at the end. This will be your opportunity to engage with us. You'll be able to submit your questions by using the Q&A tab in Zoom. Please feel free to send your questions as they come to mind throughout the presentations. We will try to respond to as many questions as possible with our allocated time. Or you have the option to email us your questions, and we will respond in the following days after the forum. An email address will appear on the screen at the end of the forum. At this time, I'd like to introduce the Honorable Audrey Gordon, Minister of Health and Seniors Care and Minister of Mental Health, Wellness, and Recovery, to bring greetings from the province of Manitoba.
Good afternoon, everyone. On behalf of the province of Manitoba, I'm pleased to bring greetings to the CancerCare Manitoba Board's annual public forum. Thank you to the organizers of today's event and to everyone who is participating. In reading the message on World Cancer Day, written by CancerCare's President and CEO, Dr. Shree Navaratnam, the cancer statistics are staggering. Cancer remains the leading cause of death in Canada. Every day, more than 600 Canadians are diagnosed with cancer, and Manitoba is projected to have 10,000 new cancer cases every year by 2035. Despite these figures, I'm encouraged by the leadership of our healthcare partners to meet the challenge ahead. We're proud of our government's relationship with CancerCare Manitoba. Last year, we were pleased to receive CancerCare Manitoba's Roadmap to Cancer Control and the Cancer Surgery Framework. These documents will guide new investments and improved cancer care services in every region of our province. The Manitoba government supports the report's 6 priorities for cancer control, and we look forward to working with CancerCare Manitoba to promote cancer prevention and screening, to deliver timely access to cancer care closer to home, provide evidence-based, high-quality cancer services, improve patient services throughout the cancer continuum, and also to ensure the sustainability of cancer care services and improve cancer control and outcomes for Manitoba's Indigenous population. I thank each and every one of you involved with CancerCare Manitoba for easing the emotional and physical challenges of those affected by cancer and their loved ones. The province of Manitoba looks forward to continuing our work with you and our many partners across the province and across Canada as we work to improve the health, safety, and well-being of all Manitobans. Thank you, and enjoy the rest of the Provincial Cancer Care Conference.
Thank you, Minister Gordon, for your kind words. We are grateful for the government support of cancer services in Manitoba. I'm glad to see that we have well over 80 people joining the forum so far this year. Before our presentations from Dr. Navaratnam and Ms. Moore Rattray, I'd like to provide some information on the CancerCare Manitoba Board of Directors. The CancerCare Manitoba Board is made up of 6 Minister of Health appointees, 3 corporate appointees, Chair of the Advisory Medical Board, University of Manitoba Board of Governors representative. Also attending are the President and CEO of CancerCare Manitoba, Dr. Navaratnam, Chair of the Medical Staff Association, Dr. Don Houston, President and CEO of the CancerCare Manitoba Foundation, Ms. Patty Smith. The board has a number of committees to which members are appointed. Committee membership also includes very important community representation. Committees of the board include an executive, community connections, facilities planning and development, finance and audit, quality and patient safety, as well as research. I'd like to take a quick moment to highlight the research committee, as this is a new committee of the board. We are very fortunate to have a very strong research history at CancerCare Manitoba. In May of this year, 2021, the board supported a change in governance structure and renaming of the institute to CancerCare Manitoba Research Institute. This change maintains our close and very important affiliation with the University of Manitoba. With the new governance structure, the Board of CancerCare Manitoba established the Research Committee. It was constituted and began functioning as a committee with its first meeting on October 18, 2021. There is a lot of work to be undertaken in this inaugural year, and I thank the committee chair, Ms. Jan Belanger, and the members of her committee for their commitment. Dr. Navaratnam will provide more information on the research as a foundation and their priorities for cancer control. The COVID-19 pandemic continues to be a challenge for everyone. I would like to acknowledge and thank Dr. Navaratnam for her leadership and the executive team, as well as all the staff and volunteers of CancerCare who have ensured that cancer services for patients continued throughout the pandemic. We plan to build our capacity to accommodate the projected increase in the numbers of patients requiring cancer care. Addressing our immediate needs and stabilizing and strengthening cancer services for the years to come will be accomplished with our health partners. We're very pleased that CancerCare Manitoba is an active partner with Shared Health in planning for the expansion of the Health Sciences Centre University of Manitoba Bannatyne campus, which will include expanded facilities for CancerCare Manitoba. CancerCare Manitoba has aligned itself with a total health system transformation, as this has unfolded in Manitoba, and working closely with Shared Health and the Transformation Management Office, CancerCare embraces the opportunities that this will bring. We are committed to provide care that is patient and community-centered for all Manitobans, regardless of race, ethnicity, geography, socioeconomic status, age, or gender identity. As a board, we acknowledge the continuing challenges of racism in the health system, as equitable cancer services for all Manitobans is paramount. At this time, I'd like to introduce Dr. Shree Navaratnam, President and CEO of CancerCare Manitoba. Dr. Navaratnam has been in this role since 2014, and as a board, we are grateful for her strong leadership and vision, not only for CancerCare Manitoba, but for cancer control and cancer research throughout the entire province, as well as nationally and globally. Dr. Navaratnam.
Thank you. Thank you, Mr. Chipman. And good afternoon, everyone. On behalf of CancerCare Manitoba and the Board of Directors, I'm very pleased to welcome everyone to our annual public forum. It is very exciting to see many of you in this virtual format, and thank you all for joining us. And we all heard from our Honorable Minister. Thank you, Minister Audrey Gordon, for bringing these greetings today. And thank you for your leadership and the commitment for cancer control. And I was so pleased to hear that you were able to list our 6 priorities. That gives me that confidence how committed you are. So thank you for that leadership and commitment. The annual public forum is taking place in connection to the Provincial Cancer Conference, which is one of our activities yearly. And I really like to acknowledge and thank the CancerCare Manitoba Committee for putting together a well-planned conference that always had a very positive impact on attendees. And I heard today, this time around, we have the highest number of people attended the conference, and we had a very timely keynote address on resilience and support and empowering the staff. So thank you. And also, like to thank the attendees for your participation, because you will continue to prepare you as you provide high quality cancer services across Manitoba. So thank you, attendees, as well. Moving on, we cannot address an annual public forum without talking about COVID. So for all of us, 2020 and 2021 have been challenging years. It has been a period of COVID-19 fears, restrictions and isolation, and of course the uncertainty which continues. And very importantly, the cancer patients and their families who were already carrying this emotional and physical burden of cancer diagnosis and treatment, they're doubly impacted by the pandemic. And really like to applaud our patients who bravely continued navigating the cancer system throughout the pandemic. And they really supported us in the operational changes we made to accommodate restrictions. Thank you. Thank you to all. At CancerCare Manitoba, we remained committed to maintaining high quality cancer services in the COVID-19 adapted environment. That doesn't come easy. It has come with a commitment with all of our staff. So I'm very grateful to our staff who quickly adapted their practices and who have continued to be available to patients every day to provide them with the best care possible. I think this is the time I want to take a pause and applaud all the CancerCare Manitoba staff and staff of the healthcare in Manitoba and nationally, internationally. So we are also grateful to our provincial partners for their continued provision of cancer services to patients throughout this pandemic. So thank you. One of the learnings of the pandemic has been a renewed appreciation for the value of people in our lives, including our colleagues and families and caring communities. Together, we have faced challenges and shown compassion, resiliency, and strength. As we continue to manage the challenges of the pandemic, it's good to take the time for self-reflection and self-care. It's very important, and as well as time to reach out to others around us and to identify how we could support them. So this is extremely important. What we all have is our body and mind, so we really need to take care of us. Moving on to sharing some information on health system transformation. Over the past years, health system transformation has continued its goal of bringing a provincial approach to health services. We have continued to work closely with our partners towards this goal. Transformation in Manitoba, health transformation in Manitoba has accelerated some of the cancer priorities. To name few, the expansion of cancer services in Brandon recently announced. CancerCare Manitoba's provincial leadership in cancer surgery. We had an excellent networking session this morning as part of the conference. And partnering with the health to plan a CancerCare Manitoba expansion to another facility, which is going as a collaborative partnership to plan with the University of Manitoba and with Health Sciences Centre as one campus. So this is the year that we are moving from one 5-year plan to a new cancer control map. So I just wanted to give a highlight on that. And as we heard, despite these unexpected challenges of the pandemic, at CancerCare Manitoba, we continue to advance our cancer strategies and priorities. We transitioned from the 5-year strategic plan, which was a Manitoba Cancer Plan from 2016 to 2021, to the priorities of the Roadmap to Cancer Control Manitoba 2020, which was referenced earlier by Mr. Chipman and by our Honourable Minister as well. We look at the 5 years of Manitoba Cancer Plan. CancerCare Manitoba's capability to deliver safe and high-quality cancer care was confirmed in our successful achievement of accreditation with exemplary standing, the highest level, in our survey in 2015 and 2019. They also noted that, within quotes, sound process in place to ensure fiscal accountability and responsibility. The key findings of an operational review that was happened in 2019 again confirmed our good position, with recommendation aligning with the principles of health transformation. Moving on to our data, which is the outcome data or health data, we also have a strong reputation of having a cancer data collection, which has been used to benchmark our institution or our province nationally and internationally. As noted by our external consultant, CancerCare Manitoba, or rather Manitoba, benchmarks very favorably against multiple developed countries for cancer survival. We were very pleased to publish this information as the Manitoba Cancer System Performance Report in 2019, which is available on our website, including our roadmap and the progress report. Please visit our website. Moving on to research. Research is a key part of our provincial mandate and has played a key role of our organization since our beginning in 1930. Today, CancerCare Manitoba's strong commitment to research continues in order to bring tomorrow's treatment to patients today. In May of this year, the commitment was further strengthened as we implemented a change in our governance and renamed our research institute as CancerCare Manitoba Research Institute, Care Through Discovery as our tagline. Taking discoveries from bench to bedside and back to again to bench is that goal of a comprehensive research program that directly benefits patients. As mentioned by Mr. Chipman, we are very excited about these changes and the investment from the foundation to build our research facility and bolster recruitment as we move forward with research in the future. Through these activities, we will elevate Manitoba's role in cancer research nationally and globally. At last year's annual public forum, I was very excited to present the roadmap and walk through those 6 priorities. To go through them quickly, number 1 is prevention and screening. Number 2 is delivering timely access to quality cancer care closer to home. And number 3 is providing evidence-based, high-quality cancer services. And number 4 is improving patient experience. And number 5 is sustainability, which is critical as we see the increased number of cancer incidents. And number 6 is improve First Nations and Métis and Inuit cancer control and outcomes. The roadmap priorities call for high-quality, equitable care to all Manitobans, regardless of age, sex, religion, and location in their province. Unless these diversities are recognized in the health planning, in our cancer planning, we are not going to move forward with our outcome. We need to acknowledge the challenges of racism to bring equitable care. As an organization, as CancerCare Manitoba, we are committed to a culture of equity, diversity, and inclusion for all our staff and the partners who visit us, and of course to our cancer patients. The first step of implementing the roadmap to cancer control, as we talked about, is strong community engagement with many stakeholders is very important. Priority 6, which is the roadmap to call to improve cancer control and outcome for First Nation and Métis and Inuit population, again needs significant community engagement. This involves working directly with Indigenous communities and partners to understand their unique needs, to develop an action plan and progress or performance indicators to measure the success. We will do it with the community to come up with those action plans and paths to success. We had very meaningful engagement with many partners, starting with various Indigenous communities, health regions, and the physician networks, who particularly primary care physicians who provide care to these communities. And so far, I'm very pleased with the progress we made with the community engagement. And one of the community engagements we would like to focus today is the significant progress we made with the Southern Chief Organization. So we'll hear from Jennifer Moore Rattray, who is the Chief Operating Officer from Southern Chief Organization. And I'd like to thank her for her leadership and to her team for their commitment to advance cancer control priorities in their communities. And I want to acknowledge the support from our foundation, CancerCare Manitoba Foundation, and CPAC, Canadian Partnership Against Cancer, towards these initiatives. Before I conclude, I'd like to thank the broader community and extend my gratitude to Manitobans. Your continued generosity and support to CancerCare Manitoba through the CancerCare Manitoba Foundation is highly valued. Some of the progress I outlined and some of the highlights that I did, it couldn't have been possible without your generosity and this deep commitment of the CancerCare Manitoba Foundation and their board. So thank you. Now I'd like to invite Ms. Moore Rattray. Jennifer, please take it on.
Egosani, Chimigwech, and thank you so much. I'm going to put my glasses on. I'm going to need them to see. Dr. Navaratnam and Mr. Chipman, just thank you so much for your leadership and for the work, the really hard work that your team does and teams do each and every day, the board of directors and of course the staff. I think all of us virtually and here in this room have had our lives impacted by cancer. In my case, my grandmother, my grandfather, and my mother-in-law. So this is really important work, and so it truly is an honor to be here. I'm going to move to a few slides so I can tell you about a really exciting project that we are part of, and that is a partnership to improve First Nation cancer control and outcomes in southern Manitoba. Now, as referenced, I'm Chief Operating Officer at Southern Chiefs Organization and really proud to be so. I'm also a very proud citizen of Papikasis First Nation. And who we are, a Southern Chiefs Organization, for those of you who may not know, we are led by a wonderful, incredible Grand Chief, Jerry Daniels, and we represent 34 Anishinaabe and Dakota nations in what is now called Manitoba, Southern Manitoba, more than 80,000 citizens. So we actually comprise more than 10% of all First Nation peoples in Canada, and we support our citizens on and off reserve. Now, there are inequities and there are obstacles to accessing healthcare services. In fact, there are longstanding and well-documented data that shows an 11-year and growing gap in life expectancy between First Nations people in Manitoba and all other Manitobans. So what we all want to do collectively together is to work to close that gap. Now, there are many reasons for that gap, and one of them was referenced earlier by Mr. Chipman, and that is systemic racism. So Southern Chiefs Organization conducted a survey this year in 2021 to try to get to the bottom of some of those healthcare gaps. And this is what we found. More than 90% of First Nation citizens say that racism is a problem in Manitoba's healthcare system. More than 50% are deterred from seeking healthcare due to their previous experiences of racism. So that's what we want to work on together. There's also a couple of examples examples of quotes of information that citizens, respondents provided to us when they were filling out that survey. And one of the quotes is, "I'm scared to get sick, to go to the hospital. I usually wait until I'm very sick before going. I don't trust the healthcare system." So we want to change that. I'm going to show another quote here. "It's normal for me, like something you get used to. I'm used to being treated differently because of who I am. It is a daily occurrence to which other people act shocked when they witness it." So here's the current reality. Cancer is an important concern as the incidence of cancer and the number of deaths from cancer have increased among First Nation people. The cancer incidence rates for all First Nation people are higher than the rates for all others in Manitoba. Just one example, kidney cancer is 3 times more common in First Nations people than in all others living in Manitoba. Here are some screening gaps because we know screening is so important for prevention and also for early diagnosis. So the rates of breast cancer screening are significantly lower for First Nation people than for all others in Manitoba. There are many First Nations not currently reached by mobile services, so we're really trying to work on that together. And so the result of that is that First Nation women need to leave their communities for breast cancer screening. And of course, if you don't have transportation, as an example, that can be tricky, if not impossible to do. The provincial colorectal screening rates for all others in Manitoba are, again, dramatically higher, 2 to 5 times higher than for First Nation people. And screening rates for First Nation women are lower than rates for all other women in Manitoba. So that just provides a little bit of context in terms of why this project and this work is really so important. So what are we doing? Well, we are working together to make a difference, and that is why I'm here today, and that's why we are just so excited. And how are we going to do that? Well, like any good project, we're going to begin by building the relationship. And this is how it happened. It really began in January of 2020 with an invitation to participate in the CancerCare Manitoba Roadmap to Cancer Control Visioning Session. We don't often, as First Nation organizations, receive invitations to help co-create something. So we were excited and attended, and were really blown away by the speakers, the information that we received, and really, really proud to be a part of that process. So thank you so much for the kind invitation. That relationship continued in the fall of 2020 when we worked together to train 56 Southern First Nation community connectors, and they were trained as part of the Canadian Partnership Against Cancer. And what community connectors do is they are First Nations people who work in their communities or in urban Indigenous communities to connect somebody who maybe is newly diagnosed and they need some assistance in terms of how to connect, or they need support on their cancer journey, they need information. So just to be that friendly face. Some of them are health leaders, others might be those who are survivors of cancer, but they're really important people in communities to make those connections with the services and supports that are available. So we trained 56 of them. And here's a quote from one of them that just shows the value of the training. Losing a parent to cancer just recently, all of this information would have been of great help to me as I guided my parent through their cancer battle. Now that I have all this information, I'm ready to help my community members. Everything was helpful. So that really speaks to the quality of the training. So again, thank you for that. Well, what is the next step? Well, Shree spoke about Priority 6, improving First Nations, Métis, and Inuit cancer control and outcomes. So the next step is our partnership project. And what we're really focused on in this really respectful partnership relationship that will be and is First Nation-led is to identify, implement, and measure relevant, realistic, and culturally responsive action items that come from the community. Nobody knows what will work other than the folks on the ground. The grassroots people in communities know what will work for them, what the barriers are for them. So that's who we want to speak with and connect with, as well as, of course, the health leaders in those communities as well. We're going to build trust together, and we're going to remove some barriers. So right now, we are hiring a First Nations project coordinator, thanks to funding from the CancerCare Manitoba Foundation. So thank you for that. Well, this is really a new way of working. So we're going to begin on this project with meaningful consultation with leaders and Southern First Nations citizens. We're going to speak with health directors and elders and knowledge keepers and community connectors, I've mentioned them, and also the community at large, men, women, youth, two-spirit, and gender-diverse peoples. And we're going to ask those questions like, what will work in your community? What should we focus on in the next 3 years? And how can we assess if our co-created plan is working? Now, the next stage of the process is development and implementation of our action plan. And that is, will of course be guided by elders and knowledge keepers and determined by each First Nation's priorities. So really respecting that each First Nation is distinct, it has its own ways of working and ways of leading. So we really want to, and we always do, respectfully follow our community's lead. So the process will then move to assessment of the action plan, which is input from leaders, communities, and urban working groups. We'll collect data and surveys and also the presence of mobile units. And of course, there will be a formal evaluation because that qualitative as well as quantitative information is so important to know that what we're doing is working. And of course, it has to be sustainable. So thanks to health transformation initiatives and negotiations that we are currently having with our federal and our provincial treaty partners, Canada and Manitoba, we know that this project will be sustainable as well and that we'll be able to actually implement the action items that we come up with together. So this is very timely. There was an MOU signed between Southern Chiefs Organization and the Government of Canada in June of 2020, one of, I think it was Minister Miller's first virtual signings. So that was a really important day for us. And as mentioned, we're in negotiations with the province of Manitoba. And what we're really working toward is equitable access, culturally appropriate healthcare for elders, youth, families, and communities, community-based First Nations health system, and again, that important word, sustainability. So as I wrap up, what are we looking at? Well, we're really talking about reconciliation in action. Healthcare is a human right. And so the work that we're doing together with CancerCare Manitoba aligns with the Truth and Reconciliation Commission of Canada's calls to action, with the calls for justice from the National Inquiry into Missing and Murdered Indigenous Women and Girls, with the United Nations Declaration on the Rights of Indigenous Peoples, and of course with our very important treaties and Indigenous rights. All of those documents call for healthcare systems and service providers to end inequities and implement actions to improve the health of First Nation peoples. So what will the impact be? It will be an action plan for cancer control for First Nation citizens of the South, true partnership, and also knowledge sharing and a new legacy that we can all be proud of. So Chimigwech, Pitamaya, merci, and thank you so much for your time. And once again, thank you so much for the invitation. Egosani.
Thank you, Shree, and thank you, Jennifer. I really believe that this initiative and partnership, I think, can become a very important model for how all healthcare providers ensure that we always provide equitable health care throughout the province and for all Manitobans. Very, very important, and we're very proud to be part of it. Before we move on to the question and answer period, I would like to take this opportunity to acknowledge the CancerCare Manitoba Foundation. Its new president and CEO, Patty Smith, who took on the role in April of 2021, as well as the chair of CancerCare Manitoba Foundation, Mr. Steve Croft. CancerCare Manitoba is so very grateful to the foundation and its board, as they have been for many years, and how much they support our organization. We want to specifically acknowledge and thank them for their commitment to the investment in research at CancerCare Manitoba. And finally, I want to thank all of you Manitobans. The work of the foundation, which is so important, is only made possible because of your generous support of the foundation, and thus the support of what CancerCare Manitoba tries to do for all Manitobans. At this time, Dr. Navaratnam, Ms. Moore Rattray, and myself would welcome your questions. Again, if we do not have time to respond to your questions because of the time allowed, please email us. The email address will appear on the screen at the end of the forum. Now I think we'll try and our first question.
Do you want to read the questions, Mr.
Yeah,
Chipman?
I think I'll read it and then
I could respond to it.
and
Sure.
I'll defer to you for obvious reasons.
Thank you. Thank you.
So, what are the lessons learned from COVID? Is there a silver lining?
Thank you. I mean, it is a very general question, but it is very specific to healthcare and CancerCare Manitoba as well. So there are lots of lessons, but I'll kind of focus to CancerCare operations. And so the most important thing first of all, is the commitment of the staff. Like, it's unbelievable of the healthcare system, whether it's CancerCare Manitoba staff and otherwise, is the commitment of the staff and the collaboration that happens between the system. It's one of the learnings, and I said it should continue, and it will continue. And there are a few things in the operations, the one of which is that I think everyone heard about is a virtual care, right? So can we do virtual care? Whether it is CancerCare Manitoba or in other places. But one thing we have really adopted is the virtual care. Not only seeing for patients, but our meetings. Like, we do discuss DSGs or the cancer cases, like a patient cases by multidisciplinary team as a case conference. And now that we have adopted that as a virtual case conference, there's more participation from busy surgeons or oncologists or radiologists. So there are many of those learnings, but that is something I would highlight it as the most important one. I think you could take the question away from the screen after we read the question.
Okay, do you want the next question?
Sure.
Okay. What are the biggest topics that the Research Institute will focus on? Examples of exciting new research, for example.
That's a very good question to hear at this forum. We talked about, myself and Jeff, Mr. Chipman has spoken about the new name, CancerCare Manitoba Research Institute, with the new tagline. I think with this comprehensive plan, we wanted to bring the research more closer to patient care. That's what we say, care through discovery. So a few examples, as the question asks, is one is that we have a multidisciplinary research team. So even when you ask a research question, it's not just a one scientist ask that question or work on the question, but different people come together, whether they could be pathologists, or they could be fundamental biologists, or they are oncologists or epidemiologists, to see how the breast cancer, for example, if the question is on breast cancer, how this breast cancer treatment impact in the population. So that is the strength of our institute, because we are one Cancer Research Institute in one CancerCare Manitoba for the whole province. So we have lots of data resources. So how we connect that to all the data of the lab, like whether it is genetic mutations and whether we know the cancer biology. So that is the strength, I would say, and the excitement is bringing all of us together and have more closer to patient.
Okay.
And there's another question on Research Institute. The question is prevention, cancer prevention. Cancer prevention in general, before I go to the research, is a very, very important part. And CancerCare Manitoba had the mandate, but it's of course like any diseases that, we focus on the disease, that's what it is, cardiac disease. Once people have a heart attack, we know how to act. Somebody has a breast cancer, we know what to do. But prevention is very, very important, and we are taking a very strong leadership role and some investment into prevention. Again, I have to thank the foundation. Without their support, we cannot move with prevention initiative. So our roadmap, the first priority is cancer control, priority is prevention and screening in improving screening for cancer. So that is at the level of the clinical operation. So anything, as you said, research and innovation has to drive those cancer control priorities, including cancer prevention. So we have an opportunity of having a project called Tomorrow Project. This is very early in cancer prevention. So all Manitobans, we could participate in this project, so that we'll understand how the cancer is formed or why is it and all that. So, and then we have lots of focus on the screening research as well. So don't forget any disease prevention, including cancer prevention. Any other questions, maybe from the panel? Jennifer, do you have any questions to ask me?
Any questions to ask you? I have so many. I think the one comment I would make would just be based on the first question that you answered, which is different ways of working. And one of the things that I've seen from a First Nations perspective is the way that that different entities that maybe didn't work so closely together just because they didn't need to or have to, now are working really closely together. So as First Nation organizations and as Southern Chiefs organization, working of course with CancerCare Manitoba, but also with our, with the province of Manitoba, with First Nations in Inuit Health Branch, and with other partners. And it's really been wonderful to come together, and we've actually talked. In fact, I have a meeting this afternoon on this. We have a weekly meeting on Fridays, but it's how we continue to collaborate and how we continue to build on those relationships that we have created during the pandemic. So as quite frankly tragic as the pandemic has been, let's take those threads that are positive and let's really work with those so that we can weave that stronger healthcare system together.
Okay. Thank you, Jennifer. I mean, that's the key on the silver lining about learning collaboration, even though we started this collaboration prior to COVID, but it is a very, very important, and it's lots of learning to all of us, right? So that's the community collaboration with the partners and national and all that. So thank you for that. So there is another question here. Are there action plans made to advocate cancer care prevention in the communities in the southern Manitoba after the partnership has been established? Would you be able to bring Jennifer on the camera? Not the question. So it's to you, Jennifer. The question is, what are some of those activities that you took it on?
Absolutely. Well, I think what we always want to do is to really go to the community and get that guidance from the communities, and as mentioned, from the health leadership, from our chiefs, of course, from our counselors, and also from elders, from knowledge keepers, wisdom keepers, from youth. So there absolutely will be action plans, but those will be developed after we have those really important conversations in the community to really talk about what our community members, what our citizens want and need. And again, this is going to be on and off reserve. So we'll also be doing work in Winnipeg, in Brandon, in Dauphin, in a number of urban centers as well. So we will have an action plan, but I can't tell anybody what it is right now because we're going to take our direction from our community members. They will lead and we will follow. Thank you.
Thank you. Thank you. Is there another question to any one of us?
Well, there was a question about a new building, but I think that was, as we mentioned, the plan for the Health Science Center campus. We're very involved in the process of really identifying priorities for the Health Science Center campus. There's so many important things that are doing there and things that need to be improved. We're very fortunate that CancerCare is part of all the discussions on that. There's lots of planning to be done, but I think we're confident that the collaboration that's going to go on between CancerCare and Health Science and Shared Health will really be positive things for the province of Manitoba. So we think there's good plans there, and we're very pleased to be part of it.
Thank you. I think there's another question here about the breast cancer screening in a remote location. I've seen cervical screening by public health nurses in remote Mexican communities work very well. So that's a very, very good question about screening. And so, right now, I just want to give a general, there is reference made to cervical screening as well. So we have 3 diseases that we screen. Hopefully we'll get to the 4th disease as well. So we screen for colorectal cancer and for breast and cervical screening. So we have the CancerCare Manitoba operate the screening programs and also the operations when it comes to most of that on breast cancer screening, which is by mammography. So we do have mammography availability throughout the province and also as a stationary mammography, but also we have a program as a mobile mammography which goes to very remote locations. So that's a good question, but it is available. We have 2 vehicles that travel around throughout the province. So there is information available on our website about that. And when it comes to cervical screening and colorectal screening, we encourage and participate, but the primary healthcare providers actually do the pap smears, but we coordinate those programs as well. So yes, screening is very important. And again, the questions being asked about First Nations and plan to take cervical screening into the reserves. And those are some of those discussions that needs to come out through these discussions and partnership. And how can we do it, right? So screening, it's true, cervical cancer, it's a concern in this community, in our first community or first Aboriginal communities, and which is because they tend to come with an advanced stage. So screening for all cancers, including cervical cancer, is very important. And having said that, I'm very pleased with the data that we saw with Hpv vaccination. That is, again, for prevention of cervical cancer, that there is a vaccination. And that the uptake of Hpv vaccination, it has been much more uptake in the northern region and in these communities. So I'm very, very pleased, but thank you for that question. We'll work on that.
And if I can add one quick point,
Please
I
do.
do know that there was recently the mobile breast cancer screening vehicle was in Saugeen, and one of the Southern First Nation communities, and also that at Southern Chiefs Organization, we're also posting where the mobile screening is being located so that we can really make sure that people are aware of when the screening is occurring so that they can make an appointment and so that they can make plans to try and get there. So we're really trying to do our part to better promote where CancerCare Manitoba is holding its mobile screenings.
Thank you.
Another question here. Did COVID-19 affect the ability of cancer services to be delivered in Manitoba?
I was waiting for that question, so thank you. Thank you for asking that. And so, yes, COVID-19 had significant impact on health services. This is something that we all are challenged with, and we all need to work together. But when it comes to cancer services, if I have to be very specific, because cancer services range from screening for cancer to treatment and different treatments. So when it comes to screening, first we'll start with screening. When we had, in the first 2 months, that is in the 2020, immediately after it's been called for pandemic, we stopped the service of breast cancer screening for two months, and for various reasons and for obvious reasons. And so then that got resumed, and we were able to really step up and putting some resources into that. And the backlog is still there, but not huge. So hopefully we'll be able to get to that by before the end of next year or in the middle of next year. So that's for screening. When it comes to treatment, I'm very, very pleased to say the number of chemotherapy that we delivered during this pandemic was no change at all. In fact, there was slightly increase when we looked at the data. And the same thing with radiation. So that's what I'm so appreciative of the patients and the staff are able to maintain this chemotherapy and chemotherapy and radiation. Of course, the number of people received the service as consultation didn't change either. Only thing is, as I stated earlier, that changed into virtual. Coming to cancer surgery and diagnosis and cancer surgery, we monitor the number of diagnostic pathology come to us. And we monitor that every month. Again, there was a dip, and then it all came back. So that's kind of a saying the diagnosis, yes, there may be some pockets of problems in certain cancers, but overall the numbers didn't go down. And we also looked at the cancer surgeries numbers till end of last year, because it takes time for us to get the data. And that shows, yes, of course, there is some backlog, but it's a small amount of backlog. And as I said earlier, that we were very pleased the cancer services, including cancer surgery, for mostly maintained. But I don't want to leave the impression there is absolute no impact. No, that's not true. There is an impact, but I think we're pleased with what we are seeing.
Thank you, Shree. Another question, can you give us some examples on what role elders can have in an organization like CCMB in providing culturally responsive care?
That's again an excellent question, and I would want Jennifer to answer, but because it's asked about CCMB, I'll first go, and then Jennifer, you could jump in as well. Just to highlight one of our recent engagement or project that we started, and thanks to the team, there is many were involved, Ruth Lowen, Patricia, and Larissa, many people in the team. What we have done is and then of course our psychosocial group under the leadership of Paul Penner, and where we have combined the psychosocial oncology specialists or the counselors with the elders to provide a specific support for this community of our Aboriginal community. So that has going very well. And so, yes, there is an elder participating in that, and we would continue to do it. So answer to your question, yes, there is a role for them,